Eustachian Tube Dysfunction, or ETD, affects millions worldwide, causing symptoms like ear fullness, hearing loss, tinnitus, and barotrauma. Balloon dilation of the Eustachian tube, BDET, is a minimally invasive solution for chronic ETD. In this video, we'll explore the anatomy, indications, procedure, and outcomes of BDET. The Eustachian tube is a 3 to 4 centimeters passage connecting the middle ear to the nasopharynx. It plays a vital role in pressure equalization between the middle ear and external environment, drainage of middle ear secretions to prevent fluid buildup, and protection against infection and noise by regulating airflow. When the tube fails to open properly, negative pressure and fluid accumulation lead to chronic ETD, requiring intervention. BDET is recommended for chronic obstructive ETD lasting more than 3 months despite medical treatment, recurrent otitis media with effusion in adults, barotrauma affecting divers, pilots, and frequent air travelers, persistent ear fullness, tinnitus, or hearing loss from ETD, and candidates for middle ear surgery needing optimized Eustachian tube function. However, BDET is contraindicated in cases of active infection, such as acute otitis media, anatomic abnormalities like cleft palate or skull-base tumors, patulous Eustachian tube, which may worsen symptoms, severe nasal or sinus disease affecting access to the tube, and history of nasopharyngeal cancer or radiation therapy, increasing complication risks. Before performing BDET, a thorough evaluation is essential, including clinical history and exam to assess symptoms, tympanometry to confirm abnormal middle ear pressure, nasopharyngoscopy to examine the Eustachian tube opening, audiometry to evaluate hearing function, and imaging like CT or MRI when structural abnormalities are suspected. BDET is typically performed under local or general anesthesia in a 15 to 20-minute outpatient procedure. The steps include patient positioning, endoscopic access with a flexible or rigid endoscope inserted through the nasal passage, balloon catheter placement with a 3 to 6 millimeters balloon positioned inside the cartilaginous portion of the Eustachian tube, balloon inflation to 10 to 12 atmospheres for 1 to 2 minutes to expand the lumen, balloon deflation and removal, and postoperative monitoring where the patient is observed for complications and discharged the same day. BDET offers several advantages, including being minimally invasive with no external incisions, long-term symptom relief improving Eustachian tube function, reducing the need for ventilation tubes and preventing repeat surgeries, fast recovery with most patients resuming normal activities within 24 to 48 hours, and a high success rate with 60 to 90% symptom improvement in chronic ETD cases. While BDET is generally safe, potential complications include epistaxis, which is usually minor and self-limiting, temporary sore throat or ear pain from tissue manipulation, barotrauma which, though rare, can occur with overinflation, and persistent symptoms requiring repeat procedures or alternative treatments. For optimal recovery, patients should avoid nasal blowing or strenuous activities for 48 hours. Use nasal saline irrigation or mild decongestants to reduce inflammation, and follow up at 2 to 4 weeks for tympanometry and audiometry assessment. Balloon dilation of the Eustachian tube is a safe, effective, and minimally invasive option for chronic ETD, offering an alternative to traditional ventilation tubes. By restoring Eustachian tube function, BDET significantly improves patient outcomes and reduces the need for recurrent interventions.